Hello, cruel, cruel world. My name is Dr. Shaham Das, and consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahaminous. Now, let's face it, therapy can be expensive, so it's only right that you should know if yours is a decent dude or a rotten leg. So in this episode, we're going to explore 5 signs to decide whether your therapist is good or not. And we're going to think about a hypothetical therapist called Dr. Whack. Also, I'm going to answer some other questions such as when is a therapist allowed to breach confidentiality? I'm not just going to talk about it in an airy-fairy way. I'm going to give you very specific examples. We're going to do a psychoanalysis of why some clients might feel sexually attracted to their therapist, so the psychodynamics behind that. And I'm going to tell you about the price of private therapy in the UK, in case you're interested in using it. And we'll talk about the disadvantages of using NHS, so the National Health Service therapy. So just a very quick summary of my therapeutic background. I don't give therapy day to day because I work with offenders as an expert witness, but I've definitely facilitated therapy previously in my training, and I've worked with dozens of psychologists that give a whole range of therapy on a regular basis. I've led multidisciplinary teams with very good psychologists on them. I've also worked with some not very good psychologists and therapists, so that's helped me understand the difference and helped me inform this video. Right, before we move on, I know you guys are nerds and you like stats. I'm speaking to you specifically, college boy. So here's some stats. The exact number of people who access therapy is really difficult to pinpoint, and that's because there's multiple avenues for therapy. You can get it from different sources. You can get it through the NHS, there's private therapy, there's charities, there's online platforms, so there's too many kind of different sources to track data, and they all do it differently. However, I'm not trying to avoid the topic, I'm just saying it's difficult. However, I can tell you that NHS England reported that 1.76 million people in England were referred to therapy, for example, cognitive behavioural therapy in 2022, 2023. So what does that mean as a statistic? Let's put that into perspective. That is a shipload of people. Of course, not everybody who's referred to therapy actually receives treatment. We all know that very good saying, not every pancake you flip ends up back in the frying pan. But I think it's fair to say that if that many people are referred, then it indicates significant demand. Okay, enough foreplay, Jorge. Let's get into the myths. Cue the music. Okay, number 1, the first myth that your therapist is not very good at their job is unprofessional boundaries. So what does that mean? Just like revels, there's lots of different types of unprofessional boundaries. So type 1 of unprofessional boundaries is oversharing. So is Dr. Whack talking too much about his personal life? And does it feel awkward to hear the discomfort in his voice when he speaks about his daughter dating an ethnic man, his words, not mine, that's 5 years older than her? So you might think, apart from the awkwardness, what's the problem? Well, first of all, you're wasting your money and your time because he should be looking inside your head, solving your problems. But more importantly, it creates an unbalanced power dynamic. So it does that by muddying and obscuring the professional boundaries. So as I said, I do have some experience of actual therapy. I've got a lot more experience of talking like one-to-one sessions within patients in these secure hospitals or working as an expert witness. And you know, it's quite natural to make polite conversation, but we are specifically trained not to reveal personal details about ourselves to maintain these boundaries. And I must admit, it does feel a bit awkward because it's just a form of polite conversation. So they might say to you, what do you do over the weekend? Or they might be talking about their own children in the assessment, and they might say, have you got any kids? And it doesn't feel like it's prying. They're just sort of, it's a natural gap in the conversation. And we're trained to steer the conversation away from that. So if they say, have you got any kids? Do you know what I'm talking about? We have to say something like, oh, we're not here to talk about me, we're here to talk about you. And I'll be honest with you, my Psych for Sore guys and gals, it does feel a little bit patronising at times, and it feels a little bit icky. And my natural instinct is to reciprocate, to be friendly. If somebody asks you how you're doing, you kind of say the same thing back, right? But a therapist should not be doing that, is what I'm saying. They should understand the dynamic. They should understand that their client is not their friend and they're not here for a friendly chat. They need to maintain boundaries and like an emotional kind of distance. Now, as I said, I've talked about my experience in secure units, and there's specific reasons for that, because if I'm the consultant in charge of their care, if I'm a psychiatrist, then I decide whether they get leave, I decide medication. If they do something like push boundaries, then they might get, there might be some sort of punishment. So I can't be in that position if I'm too chummy with them and I'm too friendly with them. And obviously it's not the same in therapy because you don't have the same restrictions, but it's not supposed to be just a friendly chat. It's supposed to be a very sort of focused and structured way to get to your problems. So they shouldn't be oversharing. And also therapists might have to ask uncomfortable questions. They might have to challenge the client. So if they think that the client's not necessarily not being truthful, but if the client is not accepting or understanding one of their own issues or one of their psychological weaknesses, the therapist has to push that. And to do that effectively, there needs to be a professional dynamic. Okay, number 2 example of a therapist being unprofessional in terms of breaking boundaries. It's a biggie. Let's talk about the rhinoceros in the room. Dual relationships, which I think is a polite way, a formal way of saying, predatory behavior. So a therapist who wants to see you socially and particularly romantically is a big no. It's a big red flag. And it's not uncommon for clients to subconsciously feel attracted towards their therapist. That sets up that kind of possibility. And it's not just because he's hench with a rippling six-pack and a tailor-made shirt and almost no hair sprouting for his ears. There's actually specific psychodynamic reasons where a client might feel attracted. So I know what you're thinking, Dr. Das, you talk a lot of stuff, put your money where your nose is. So here are the reasons. Here's a list of why clients might subconsciously feel attracted towards their therapist. Number 1, heightened intimacy and attention. So therapy sessions often involve deep conversation and they can be about personal matters, and you're fostering a sense of intimacy and you're focused, and the therapist gives the client focused attention that they might not get elsewhere. They might not be getting at home in their own relationship. Number 2 reasons that a client might feel attracted towards the therapist is because the therapist is trained to be supportive. They're trained to be non-judgmental and encouraging. So that can lead them to feel very attractive, especially if the client lacks positive relationships. Number 3 reason why a client might feel attracted or even fall in love with a therapist is projecting past experiences. So clients might subconsciously project feelings, and there might be feelings for past caregivers like their parents or romantic partners. They might project these onto the therapist. And what's this called? Hello? Sorry, speak up. Transference. So transference is that feeling that the client gets towards the therapist, and countertransference is that feeling that the therapist gets back towards the client during these kind of emotional conversations. But a good therapist recognizes this, and they use this to understand the lying issue. So, you're talking to me like that, you're treating me to like this. Is this because I remind you of your father? Is this what you wanted to say to your father 20 years ago? Blah, blah, blah. So what I'm saying is that a good therapist, if they know what they're doing, they explore the attachment styles of a client, they explore past relationships, and they really sort of dig down to emotional needs. But a bad therapist will use that as predatory behavior. Okay, moving on to our original list. Number 2 sign that you've got a bad therapist is if there is a lack of empathy or lack of respect. So basically what I'm talking about is shaming or blaming. So a therapist should validate your feelings, and they should not make you worse. So for example, they shouldn't be using dismissive language. So a therapist who minimizes your struggles or uses terms like "you're just overreacting," that can actually be harmful rather than helpful. So for example, if Dr. Wack says, "I'm not surprised your boyfriend cheated on you when he didn't laugh at any of his jokes," you got a problem. So the bottom line is pretty simple. You shouldn't feel worse after leaving therapy. Generally speaking, you should feel better. Now, I said generally speaking because there is a caveat. There is a couple of tricky situations. For example, if the therapist is exploring previous traumatic events, then you might feel that one session feeling worse. But the important bit is they should be giving you tactics to address these feelings. They shouldn't just making you feel worse and then throw you out into the wilderness like you're a big trout that Dr. Wack has just caught, and he's chucked you on the grass next to the lake and you're flopping, dying of breath. Number 3 sign that you've got a bad therapist is a financial exploitation or financial pressure. So just like a stripper that you've fallen in love with, a warning sign is that you should get out of Dodge if they're trying to squeeze money out of you. So how do they do this? Well, there's lots of different ways. the therapist could be extending your session unnecessarily, or he could be charging excessive fees that feel a little bit sort of unethical. So for example, is Dr. Wapp blabbering nonsense to water down the sessions? Is he chatting about the weather for 15 minutes? Is he basically sort of pushing for more sessions unnecessarily? Also, is Dr. Wack charging you costs, including the petrol that he used that morning and the toothpaste that he used before your session? Is Dr. Wack suggesting that you read a very exclusive book? And is that book about how you combine analysis with therapy? Is he introducing you to the world's first analrapist by his cousin, Dr. Tobias Funke? But there's hardly any copies of this book left because they're all sold out, but he'll get you a signed copy for $65.99 and VAT. Is he trying to sell you timeshare in Tenerife? Are there hidden costs, basically, is what I'm saying. Is he implying you should tip? All of these are huge red flags. Now, I should say, obviously, a therapist deserves to get paid for their time, and it's fair to say that it's a highly skilled profession. But I suppose what I'm talking about is, does it feel like your therapist is in it for the money and not for the healing? So, quick question for my Psych for guys and gals. Have you had any experiences of a therapist that you believe is financially manipulating you? Can you give us your stories, your specific examples? Do you mind sharing them? How did you react? What did you do with the situation? Let me know in the schmeckment below. Okay, moving on. Number 4 sign that you have a bad therapist is a lack of focus during sessions. Before we get into that, let me introduce you to this channel. This is a Schmike for Small Minds. This is a smorgasbord of topics related mainly to mental health, sometimes to offending and the crossover between the two. I've been doing these 5 myths or 5 tips kind of thing. So 5 myths about depression, 5 myths about hearing voices, 5 myths about men's mental illness. Go chiggity, check it out. I implore you, please subscribe, because not only does it help me out immeasurably, but if you subscribe, next time you go clubbing, you don't have to stand in the rain for 45 minutes like a schmuck. You'll go straight to the VIP section, guaranteed, or your money back. By the way, let me know what kind of topics you want me to cover specifically about mental illness. I can tell you like 5 myths or 10 myths or 5 hidden signs, etc., etc. Let me know in the schmoment schmection, because I got you. Right, let's get back to it. So, number 4 sign that your therapist is not a good therapist is a lack of focus during sessions. So, does it feel like your sessions are basically an improv class for Dr. Wack? Is he, making things up on the spot? Is he throwing out random diagnosis like extreme intimacy aversion? And is he waiting with bated breath for your dramatic reaction? Is Dr. Wack's attention span about as long as a goldfish with ADHD? Is his conversation like a browser with 20 tabs open? Is everything random and chaotic that he's saying? Does nothing make sense? So a bad therapist can be so distracted and they can lose their train of thought, so that sometimes when they're talking, they don't even finish their, So are your sessions constantly interrupted by Dr. Wack's ringtone? Is it "This Is How We Do It" by Montel Williams? He needs to have those boundaries put in place. Do the sessions feel sort of meandering without any clear goals or directions? Does it leave you feeling confused and frustrated? These are all bad signs, and I think if that's happening, you need to wash that man right out of your hair. Okay, so quick question for you, my Psych for Soul guys. What is the typical cost of therapy in the UK? Have a guess, let me know in the comment section. I'll tell you the answers later on in this episode. Almost there, come on, just one more sign and then we're done. You can do it, get your back into it. 5th sign that you've got a bad therapist is if he is not addressing your concerns. So if your therapist constantly brushes off your concerns, it might be time to find somebody else who is listening. So is Dr. Wack imposing his beliefs on you? So therapist is about you. It's not about the therapist's personal opinions on religions, on politics, etc. Is Dr. Wack saying that there should be a wall built between England and Wales and the Welsh are going to pay for it? Does he frequently jump to his topics instead of yours? Does he feel like, you can barely get a word in edgeways and he's kind of ignoring what you're saying anyway because he's got his own theory that he wants to talk about? So to be fair, it's fine if a therapist occasionally gets the wrong end of the stick, but a good therapist should be clarifying what you mean and what he's saying, so he should understand if he's misunderstood something fairly quickly. And occasionally they might make a suggestion or an insight it's still reasonable, but it's not correct for you, it's a little bit off the mark. So what I'm saying is there's no problem if these things happen infrequently, and if you both recognise it and you move on, that's not a problem. But if it seems that he's always misunderstanding things, he's not clarifying anything, if that's the norm rather than the exception, then you need to ditch this dude. Okay, moving on. I'm going to change topics a little bit. Let's talk about breaches of confidentiality. I think it's important to know, especially if you're in therapy or if you're considering therapy. So particularly if you have some very personal issues, you need to know if and when the therapist can talk about those issues to somebody else. So the reason I'm making these videos is to educate you so you understand these things, also to take over the world, not growing great. So the therapist can share your information, but only under very specific circumstances. So for example, if you've told Dr. Watt that you've got this recurrent dream that your father is breastfeeding you, Dr. Watt is not allowed to tell his peers. He's not allowed to tell his wife to amuse her over a glass of Chardonnay at home. In the UK, there's very specific examples, and here they are. Number one reason that a therapist can breach confidentiality is if it's about serious harm to yourself or to other people. So if a client discloses that they intend to harm themselves by committing that thing that rhymes with schmooshide that YouTube won't let me say, or if they have a plan to hurt somebody else, then therapists may need to break confidentiality to prevent it, and that usually involves contacting the victim or the emergency services or the relevant authorities. Number two reason that a therapist can break confidentiality is if a child is at risk of abuse or neglect. So in this situation, the therapist has a legal obligation to report it to social services. Number three situation where a therapist can break confidentiality is legal proceedings. So in some court cases, a therapist might actually be subpoenaed, which means that they get written to by the court saying that they have to come in to give evidence, to disclose information about a client. It's quite rare. Generally, a therapist can sort of fight these requests unless a judge deems it's essential. So basically what I'm saying is if you've got bodies buried in the patio, then the therapist unfortunately might need to tell the police. Although I would argue if that's the case, then maybe you need a little more than just therapy. You need to see a forensic psychiatrist like me. Number four scenario where a therapist can break confidentiality is related to terrorism or serious crime. So if a client reveals that they're involved in terrorist acts or they've got plans or another serious crime that can endanger the public, then the therapist might report it to the authorities. The other thing I should say is in all of these scenarios, a good therapist should at least try and get their consent. So what I'm saying is they have to, even if they don't get the client's consent, they have to breach boundaries and tell the authorities anyway, but they should at least attempt to tell the client that they're going to do this. Okay, moving on, final topic. How much is the cost of therapy? How long is a piece of cheese spring? So as you probably know, you can get therapy for free on the NHS, but there's a few disadvantages. What are they? Number one disadvantages of therapy on the NHS is the waiting list. So what kind of officially is said to clients is that it's typically 6 months. I think that's what GPs say, but I actually think that's inaccurate. From my experience of working with people who I've referred to therapy, it tends to be more like 9 months or a year. Number two disadvantage of NHS therapy. Don't get me wrong, there's a lot of good therapists on the NHS. I've worked with some of them, but a lot of them are also inexperienced. So they usually sort of get their experience for many, many years as junior therapists or psychologists, and then eventually a lot of them break out to do this privately. But obviously if you get them at the beginning of their career, they're not going to be as experienced, and you don't get to choose, you just get allocated somebody. So you might have very specialist needs, especially if it's related to a specific type of trauma, and the therapist you get might not have much expertise in that particular area. Of course, you can request another therapist, but then you go back on the waiting list. Whereas with a private therapist, you can check out their background and their credentials. You have a choice, basically. Some even have reviews like TripAdvisor, but for the mind. Number three reasons why NHS therapy might not be that good is a limited number of sessions. Everybody knows that the NHS is extremely overwhelmed. We've been talking about it for years, haven't we? So usually you're only offered a small number of sessions, usually 6. With the private therapy, you usually have like an aim. So the private therapy might start by saying 10 to 12 sessions. But if something else comes up, so if there's some other deep-rooted subconscious insecurity and that's teased out of therapy, then you might be able to extend those sessions. So with the same therapist, continue the same appointments slot every week, blah, blah, blah. Whereas in the NHS, you either won't get offered more sessions or you have to go back onto the waiting list. Okay, so how much does therapy cost? Well, it kind of depends on the therapist and their experience and their qualifications. So the more experienced therapy or the specialized types of therapy charge more per session. It also depends on the location. So therapy in big cities, most things, I guess, are more expensive than rural areas. Depends on the duration, frequency. Sessions typically last about 50 to 60 minutes. So it depends on your needs. Having said that, with that in mind, here's some costings. I know what you're thinking. I need to stop avoiding the question about cost, like a fat, spotty kid about to ask his crush out for the school dance. So how much does it cost? Well, counsellors who are not sort of trained psychologists, usually £40 to £70 per session. So they're more about sort of supportive things rather than actual psychological strategies and homework and like reassessing your strategies, etc., etc. People that do that are psychotherapists, CBT therapists. They charge usually about £60 to £100 a session, whereas clinical psychologists and counselling psychologists, so they've got training in a much more wider berth of therapy, charge around £100 to £180 per session. Obviously, if you go into like, you know, Harley Street, the most renowned kind of areas in central London, for example, they're going to be on the more expensive end of the spectrum. And as I said before, the more expensive therapists, generally speaking, have a higher degree of training and experience. Okay, we're almost finished. I'm just going to summarize what we've learned today, kids, and then I'll let you go. So we've learned about the signs of a bad therapist can include unprofessional boundaries. There's the obvious ones, such as predatory behavior, but there's also the more subtle ones, such as oversharing. Another bad sign would be a lack of empathy or respect. So a therapist should never be shaming or blaming. I told you that you can get free therapy in the NHS, but there's a few disadvantages, such as the waiting list. In my experience, has been 9 months to a year, and also it's a lot of potluck. There's some good therapists in the NHS, but there's some also very unexperienced ones. You don't know which one you'll get. We learned that you have a recurrent dream that your father is breastfeeding you. We learned that another bad sign of a therapist is a lack of focus during sessions, so meandering between topics randomly without really resolving or getting to the bottom of any one individual issue. Whew. Right, that's pretty much me finished. Let me know if there's any other topics that you want me to cover, particularly related to mental illness, other myths or tips, etc., signs, those kind of things. And that's it. Buy my goddamn book. Have a blessed day, and do not forget, whatever happens, do not forget, I love you.